guys, me Adam and Sean with another video. So this video is going to be me discussing on what I consider is a good nurse versus a bad nurse. First, let me just start by saying that I know this is an absolutely subjective subject matter, so just take everything I say with a grain of salt, and everything is not to be so serious, so y'all just chill, okay? So the first thing, what do I consider a good nurse? Now, me being in the nursing profession for the last 17 years, the first and foremost thing I think you need to be a good nurse is compassion. The word nurse is both a noun and a verb. It's something that you are, and it's also something that you do. So if you don't have the capacity to actually nurse a patient back to health, which means having substantial compassion, I don't think you need to be a nurse. Compassion is the first and foremost thing that I think you need to have to be a good nurse, in my opinion. Now, the second thing I think you need to be a good nurse is be knowledgeable about your patients and be knowledgeable about your whatever specialty that you're in. Meaning, if you're a geriatric nurse, you need to know pretty much, you need to be knowledgeable in geriatrics. Don't go to geriatrics if you have a large knowledge in peds without doing your due diligence. So you have to be knowledgeable. Don't go into a procedure if you don't know what the procedure is. Don't go give a medication if you don't know what the medication is. So being a good nurse means you have to be educated and be knowledgeable in whatever you're about to do. Nursing is always changing. It's always evolving. Evidence-based practice is always changing our practice. So we have to be abreast of all the latest things. This means you have to be knowledgeable, and this means that you have to continue to do research because it's always changing. Now, the third thing I think you need to be a good nurse is to be humble. Like a lot of nurses who have been doing it for a while, like leave humility and being humble like outside on the curb when they walk into work. You have a lot of these like nurses that come in, think they're just big shit. They think they're smarter than everybody. Being humble means knowing that you can make a mistake, knowing that being very mindful of everything you're doing so that you don't make a mistake, and also being open to criticism, being open to education. That lets me know that you consider your patient's safety versus your own ego, if that makes sense. So be humble in whatever capacity that you're nursing. Be humble. Humility is a huge thing that I consider when I'm thinking about who's a good nurse versus who's a bad nurse. Now, let me go. Now, I'm not saying that all of these things make you a quote-unquote bad nurse, but let me just say this. These are things that make you, to me, a less desirable nurse, if that's better. If that sits better with some of you all. So, a bad nurse, first and foremost, is being apathetic, which means no compassion. You don't really feel with the patient. You don't really care about what's going on with the patient. Now, I will say this. We do have to leave some things at work when we go home. But being completely apathetic to your patient, meaning you not having any feelings or empathy or sympathy with your patients, that makes you a bad, to me, that makes you a bad nurse. Even if you don't internalize it, you know, you have to be, at least demonstrate empathy with your patient, demonstrate sympathy with what they're going through, because like I said in one of my other videos, baby, bedside manner is king. I'm sorry, bedside manner is king. So being apathetic makes you absolutely trash nurse to me. I'm sorry, it is what it is. Do something else, okay? So the second thing that to me makes you a quote-unquote bad nurse is not knowing your limits. Now, let me just say this. When I was traveling during the pandemic, you know that money was really good, right? Money was good. They was paying people all kinds of money to travel. Now, during my travels, I met a lot of nurses that were working in specialties that they had never worked in just because the money was good. Meaning, I was working med-surg, progressive care, cardiac units with nurses that had been school nurses for the last 10 years or had been a nurse in a clinic for the last 5 years. Now, come on. You can't have been a nurse in the clinic for 5 years and then just pop up one day because the money is good on a cardiac med-surg unit. Now, come on. Come on now. You got to know your limits. So you gotta know your limits. You have to know your skill set, and you have to know your knowledge base. There's no way these nurses were qualified, and I could tell that a lot of them were not qualified by the nursing care that they gave. So being a bad nurse is not knowing your limits, knowing you don't know something, know when something is outside of your scope, know when something is outside of your skill set. That makes you a good nurse, and that also goes back up to being humble and knowing your limits, right? So, okay, one little small thing that I'm not gonna say this makes you a bad nurse, but this really does kind of change the patient's taste in your mouth. Physicians, like this little thing is kind of like a little nuance that that it took me a while to master. Is having poor to no follow-up. Okay, so case in point, back when, like a few years ago, when I first started working med-surg, this patient asked me for a cup of water, right? And I was like, absolutely, I'll go get you a cup of water. That's easy. I can go get you a cup of water. Completely forgot to get this woman a cup of water. Now, when I returned to her room about 2 hours later, without the water that she had sent me for 2 hours ago, she was highly upset at me. Now, I was just like, girl, it's a cup of water. But it wasn't so much the water, it was the follow-up. It was the trust. It was me saying that I was going to do something that I did not hold up my end of the bargain to. So follow-up is absolutely something that will make or break you in nursing. So now, like, I always keep, when I'm doing my rounds, I always keep a little pad with me or a little paper that says like water, pain meds, nausea meds, just kind of mental triggers, or follow up with physician, follow up with therapy, call patient's daughter, just things that give me mental triggers so I can know when, how I need to follow up on, because I will not. One thing, saying you're going to do something and doing it is absolutely makes you, or at least following up on something, makes you a awesome nurse. So you guys, if you have not already done so, please like this video, subscribe to my channel, hit the little notification bell in the corner so y'all can see my videos. Follow me on Instagram if you have not already done so, and comment below what makes you a good nurse versus what makes you a bad nurse. All right, see you guys in the next one. Happy nursing. Bye.